Constipation in pregnancy. What you need to know and how to manage it. Pregnancy is a beautiful journey, but let's be real, constipation can be one of those uncomfortable side effects that no one really talks about. If you're feeling backed up and frustrated, you're definitely not alone. In today's video, we'll break down why constipation happens in pregnancy and, more importantly, how you can manage it and feel better. Hey moms! Let's talk about a topic that's a bit taboo, but totally common in pregnancy: constipation. It's one of those things that many women face, but don't always discuss openly. It's normal, but that doesn't make it any less uncomfortable. So, let's dive into the nitty-gritty. Why does constipation happen in pregnancy? When does it usually occur? And what can you do to manage it? Why does constipation happen during pregnancy? It's important to first understand why this uncomfortable symptom often arises during pregnancy. There are a few key reasons why pregnancy can mess with your digestion. 1. Hormonal changes. One of the main culprits is the surge in hormones, particularly progesterone, during pregnancy. Progesterone is great for supporting your pregnancy, but it has a side effect: slowing down your digestive system. It relaxes the muscles in your intestines, which makes food move more slowly through your digestive tract, leading to constipation. 2. Growing uterus. As your baby grows, your uterus expands and can put pressure on your intestines and rectum, further slowing down the digestive process. This physical pressure can contribute to the feeling of being backed up. 3. Dietary changes. You might find that your cravings during pregnancy steer you away from fiber-rich foods or other gut-friendly nutrients. Plus, nausea and morning sickness can sometimes make it hard to eat healthy foods regularly, leading to constipation. 4. Iron supplements. Many pregnant women are prescribed prenatal vitamins that contain iron, which is essential for both you and your baby. However, iron can be a bit harsh on your digestive system, often leading to constipation or stomach discomfort. When does constipation usually start? For some women, constipation starts early in pregnancy, especially during the first trimester. This is when your body is going through a ton of hormonal changes, and your digestive system may slow down significantly. For others, constipation can creep in later, often in the second or third trimester, when your growing uterus starts pressing down on your intestines. It's also not uncommon for constipation to worsen in the third trimester, as the pressure from the baby gets even greater. Common symptoms of constipation during pregnancy. If you're wondering what exactly constipation in pregnancy looks like, here are the most common signs. Infrequent bowel movements, less than 3 bowel movements a week. Difficulty passing stools. You may feel like you need to go, but it's hard or painful to pass anything. Bloating and discomfort. Your belly feels full or swollen, and you might even feel gassy or uncomfortable. Straining. It may feel like you need to push or strain a lot to relieve yourself. Remember, constipation is a very individual experience. Some women have mild symptoms, while others experience a lot more discomfort. And while it can be frustrating, it's important to know that it's usually not a serious health risk. How to manage and relieve constipation in pregnancy. Now, let's talk about how to deal with this not-so-fun symptom. The good news is that there are several ways to manage constipation during pregnancy and make yourself more comfortable. 1. Drink plenty of water. Staying hydrated is crucial during pregnancy for many reasons, and it's especially important when it comes to keeping your digestive system moving. Dehydration can make constipation worse, so aim to drink at least 8 to 10 cups of water a day. Herbal teas like ginger or peppermint can also help soothe your stomach and digestion. 2. Increase fiber intake. Fiber is your best friend when it comes to preventing and relieving constipation. Foods like whole grains, fruits, vegetables, legumes, and beans are all high in fiber and will help keep things moving in your digestive tract. Try adding more of these foods to your meals to help prevent constipation before it starts. Tip: prunes and prune juice are natural laxatives, so they can be especially helpful in relieving constipation. 3. Exercise regularly. Physical activity can help stimulate your digestive system. It doesn't have to be anything intense. Simple activities like walking, swimming, or prenatal yoga can go a long way in keeping things flowing. Tip: aim for 30 minutes of moderate exercise most days of the week, but always listen to your body. If you're feeling too tired or uncomfortable, rest is okay too. 4. Avoid iron overload. While iron is crucial for your pregnancy, too much can contribute to constipation. If you're experiencing severe constipation, talk to your doctor. They might recommend switching to a different form of iron or taking a stool softener. 5. Consider prenatal massage. Gentle belly massage or prenatal massage can help improve circulation and ease any bloating or discomfort you might feel. Just be sure to get a certified prenatal massage therapist who understands your pregnancy needs. 6. Take stool softeners if necessary. If you're struggling to find relief, your doctor might suggest taking a stool softener or mild laxative. These are usually safe during pregnancy, but it's always best to get the go-ahead from your healthcare provider before using any medication. When should you be concerned about constipation? For most women, constipation in pregnancy is completely normal and can be managed with lifestyle changes. However, there are a few red flags to look out for. Call your doctor if you experience severe, persistent constipation that doesn't improve with diet or lifestyle changes, painful, crampy bowel movements or bloating, blood in your stool, which could indicate hemorrhoids or another issue, nausea or vomiting that accompanies constipation, especially if it's sudden or severe. Final tips for easing constipation during pregnancy. Try to stick to a regular bathroom schedule. Don't wait too long to go when you feel the urge. Avoid heavy or greasy foods that might make constipation worse. Use a footstool while sitting on the toilet to help your body get into a more natural position for elimination. And remember, it's okay to ask for help or talk to your doctor if you're struggling. You're not alone. Pregnancy brings a lot of changes to your body, and constipation is just one of those things that often gets swept under the rug. But now that you know why it happens and how to manage it, hopefully, you'll feel a little more at ease. If you found this helpful, don't forget to like, comment, and share your experiences. And, of course, subscribe for more helpful pregnancy tips and support. Take care, Mama. You've got this.